Hi Shirley, my name is Carol and I'm here to do your assessment of your cardiovascular and your peripheral vascular examination today. I'm going to be touching you, so I just want you to know that ahead of time, okay? Um, Before I start my examination, I'm going to pretend that Shirley has her shirt off, right? So if she had her shirt off, I'll be looking at her chest to see if there's any scarring. Um, to indicate maybe if she had like past abdominal surgery. If she did, I'll ask her further questions about it. I'm looking for her, I'm looking at her fingers as well to see if maybe they're blue as well. The toes, I'm looking to see if she has any edema in the feet as well too, but that are visible. Looking to make sure that the toes have hair on the toes, they're not shiny, which could indicate a lack of perfusion or an issue with perfusion, for lack of better words. I'm also looking to make sure there's no visible pulsation of the heart on the chest as well too. Alright, after I do that, I'm gonna proceed to ask Charlene to lay down on the examination table. Oh, and I'm gonna pull out the bottom to support her legs. Okay, sorry, Professor. Okay. So after we do that, we have to make sure that the patient is comfortable, right? So after that is done, we're gonna be, first we're gonna start by palpating the carotid arteries. We're gonna palpate one at a time because if you palpate both at a time, you could cause issues with blood flow and block the carotid artery as well too. So we're gonna palpate always one at a time, and we're also standing on the right side of the patient as well as two. So I'll start off by, so we're gonna ask her, can you please turn your head to the left side as well too? So I'm looking for the carotid artery. I won't go higher up. I'm going to the base by the, maybe the trachea or the mid, I'm not sure. So look, feel if it's bounded. Okay, I feel it. So we ask her to turn to her left as well too. Right, I feel her carotid pulse. Right, and I'll also go with my stethoscope, and we're gonna listen to the carotid pulsations as well too. We're making sure we don't hear any breaths when we listen to that stethoscope, and I'm gonna use the diaphragm and the bell of the stethoscope. This might be a little cold. Sorry. Okay, I don't hear any fluids. Gently once again. Sorry. I don't hear any fluids. I'll have to use my bell, sorry. I use my bell. Okay, very good. I don't hear any fluids. And I didn't feel any thrills either. Then I'm gonna proceed to check for her jugular vein distension if she has it. So once again, I'm going to ask her to turn her head to the left position as well. So when I'm looking for if I see any pulsation with her jugular vein, right? I see a slight pulsation of the jugular vein. So from that, you told us that we're looking for the I'm not sure what the landmark is, but we'll go diagonal to measure it, and it should be above 3 to 4 centimeters, which would be normal in most adults without any cardiac issues, so to speak, right? All right, after we do that, we're going to proceed. So you can put your head in neutral position now. We're going to proceed to listen to her the aortic, we're gonna listen to her heart sounds. We're gonna go over the aortic region, the pulmonic, Erb's point, tricuspid, and then last but not least, the mitral valve. So I'm gonna do both the bell and the diaphragm of the stethoscope when I'm listening, right? So when I go, I'm gonna start with my landmark I'm gonna start from the mid-clavicular line, second intercostal space, right? And I'm listening. Then I turn the diaphragm. All right, I go over. So that would be the aortic. Then I go to the pulmonic, which would be the same thing. However, it's on the left. I'm doing the second intercostal space. And listen as well. This would be the pulmonic. Then I go to the Erb's point. And I'm going to go to the tricuspid. Then I'm going to the tricuspid, then I go to the mitral, which would be the fifth intercostal space, mid-clavicular line, and I'm going 3 finger breadths over from the anterior sternum. Okay, so that's done. I didn't hear any fluid. Then I'm gonna check for her PMI. So I'm gonna ask Charlene to, if you could please turn to your left. And remember, her gown will be off, right? So with that said, we're gonna feel. We're gonna go once again to the 5th intercostal space, mid-clavicular line, and then 3 centimeters over. And then if she had large breasts, I will ask her to maybe hold up her breasts. But sometimes you will feel the PMI and sometimes you will not, right? With Charlene, I don't feel it, but it doesn't mean that it's abnormal, right? Okay, so after I do that, you can turn back over to Charlene. Thank you. I'm gonna also check for everything. She has her, I hear the love dub. There's no roots that I hear. I'm also gonna check for an abdominal if I hear any abdominal, what is it? An abdominal aorta. So I'm gonna go from the belly button, right, and then 3 finger breadths on top of the belly button. And I'm gonna listen with the bell and diaphragm from my stethoscope. Off my stethoscope, I'm sorry. I didn't hear the good. And then when we're checking for arm parts, when we're checking to see, make sure there's no murmurs or adventitious hard sounds as well too. All right, I'm gonna ask you to sit up, Miss Shirley. So then Professor will also have her sit up as well, right? And lean forward slightly, like she is doing now. And we'll do the same thing that she did laying down. We'll do it sitting up, not checking for the carotid or the jugular venous pulse, but we're also checking for the heart sound. So I'll do it once again. So we'll go to the aorta. I do the bell, diaphragm, then I go to the pulmonic, and we go to Erb's point. Then we go to the tricuspid. And we'll go to the 5th intercostal space, the clavicular line, and we'll listen once again with both the diaphragm and the bell of the stethoscope. All right, so I hear normal heartbeats. There's no S2, there's no S3 or S4 heart sound. I hear the love dub. Sorry about that. Then I'm gonna proceed to check for her peripheral vascular extremities. I'm checking her fingers to make sure they're not blue. I'm checking for clubbing of the fingers, which she doesn't, right? Then I'm gonna check her capillary refill. So I press each finger and then release, right? She should have refill in less than 3 seconds. I do this for all 10 fingers, right? Just a FYI. And I'm gonna do it for all her 10 toes as well too, right? All right, for demonstration purpose, I can't move the video down, but I did it for all 10 toes as well, okay? Then I'm gonna also check for her pulses. So I'm gonna check for her posterior tibia pulses. Right, I'm just here, so I'll just check, and I'm checking both legs, because you know, unfortunately, she still has both. All right, the dorsalis pedis. Then we're checking for the tibial, right? Then we check the popliteal. So we're supposed to have her sit back. All right, now we put on the tape once again. And we're supposed to lift the skin fold up and press deeply in order to feel it, because it's deep under her neck tissue, right? And then we're gonna check that on, also we're gonna check her femoral pulses as well. So we're just gonna pretend that we actually tested them. And we all, while we do on the left, professor, we do on the right. So we're doing the same thing bilaterally, right? And so that, then we're also gonna check her pulses in her arms. So we're gonna check for the radial. We check her brachial pulses as well. Right? Good. Oh, you can see, sorry. And I think that concludes our exam, Professor.